Hi guys. Today I will be discussing diabetes mellitus. My laptop is not working, so I'm gonna be using my phone. So first, what exactly is diabetes mellitus? So basically, diabetes mellitus is part of a group of metabolic diseases. Collectively, they are known as diabetes, and their symptoms include hyperglycemia, which is excessive sugar in the blood resulting from defects in insulin secretion, insulin action, or combination of both. Now, there are several types of diabetes, and the American Diabetic Association classifies them into type 1 diabetes, type 2 diabetes, gestational diabetes mellitus, also known as GDM, and then secondary diabetes mellitus, which can be caused by hormonal problems, pancreatic disorders, or ingesting certain drugs. Um, Type 2 diabetes is sometimes called a lifestyle disease, and this is because certain choices can increase the risk of you developing it. For example, not exercising enough, or having an unhealthy diet, and being obese. Meaning is it is diagnosed in older adults, but now due to childhood obesity, is becoming very common in young children. For the history of diabetes, diabetes has been recorded as far back as ancient Egypt, and the word diabetes itself comes from the Greek word, which means uh, to siphon or pass through, referring to the fact that one of the symptoms of diabetes mellitus is excessive urine production, and then mellitus, which means sweetened with honey, because an ancient method of diagnosing diabetes was to taste the urine of a person with the disease, and if it was sweet, that was a sign that the person suffers from diabetes. Now, type 2 diabetes mellitus is the most common type of all the different types of diabetes. It comprises 90 to 95% of diabetes mellitus cases. Most type 2 diabetes mellitus patients are overweight, and most are diagnosed as adults. And then approximately half of all patients don't even know that they have diabetes mellitus until it is too late. Now, what are the underlying pathophysiological defects associated with this disease? So, it occurs in three disorders. First, the beta cells in the pancreas, for some reason, are not able to produce insulin properly, and then there is an increased production of glucose by the liver, and third, peripheral resistance to insulin, especially in muscle cells. Obesity can contribute to insulin resistance, and reducing your weight can also reduce insulin resistance, which can help with the treatment in diabetes mellitus. Now, what are the risk factors? Family history. If there is a likelihood that mom or dad had diabetes, it's also likely that a child could have it. And then lack of exercise, having a sedentary lifestyle increases your risk of having diabetes. Unhealthy eating junk food that is high in cholesterol and processed sugar, and then being overweight. Warning signs of diabetes. The first warning sign is frequent urination. Another is weight loss, lack of energy, and then excessive thirst. So if you have a combination of these symptoms, it's wise to seek medical attention so you can get diagnosed or early. And then management of diabetes mellitus. So there are three components in the treatment of diabetes. The first is medical nutrition therapy, that is making changes in your diet and exercising regularly. Oral hypoglycemic therapy, that is through drugs that can help regulate excessive glucose in the blood, and then through the injection of artificial insulin to help regulate glucose. And then complications of diabetes. Diabetes can damage the optic nerve, which can lead to blindness, and it causes heart attack and kidney failure because the kidney cells get damaged when they are not able to process urine properly. And also it can lead to amputation because excessive sugar can promote the growth of bacteria, which can eat away skin and dead tissue, causing a limb to be amputated. Now, how can diabetes be prevented? So, the first one is to exercise at least 30 minutes every day per week, and studies have shown that it decreases the rate of diabetes developing by 58%. And then next, learn to eat a healthy diet, reduce the fat content in the diet, and eat more fiber, more whole grain, more vegetables and fruits. And then monitor your blood pressure and cholesterol, especially if you are in the risk group for diabetes. And then manage your weight and your body mass index. So this is just a brief overview of diabetes and ways to prevent it.